In the minimally invasive area, there are two major platforms for the management of surgically resectable lung cancer. The most common one practiced today is VATS, or video-assisted thoracic surgery, and the newer modality is robotic-assisted approaches to lung resection. Interestingly, in general thoracic surgery across the country, only about 20 to 25% of cases of lobectomies for lung cancer are done by VATS, and maybe 8 or 9% now by robotics. So added together, that's still less than a third of the resections that are being performed minimally invasively. Surprisingly, those modalities haven't been more widely adopted, and we're going to talk a little bit about why that might be, because it's quite clear, at least for the near term for patients, there are shorter lengths of stay in the hospital, fewer complications, earlier return to functional status, or earlier availability to move on to additional treatments like adjuvant chemotherapy if they're necessary. So it's surprising to those of us that focus in this area that there's not been more wide adoption. And it actually underscores the fact that in North America and in the United States, a lot of thoracic surgery is not done by dedicated general thoracic surgeons. It's done by cardiothoracic surgeons that have a more major focus in heart surgery, or general surgeons that have some experience in general thoracic procedures in the chest. And unfortunately, the field has evolved to the point where I think patients are better served and more well served by folks that focus specifically in this discipline. And that's what has happened in a large number of academic medical centers around the country, is that divisions of cardiac surgery and thoracic surgery are separate entities these days, not because we are at war with each other, but because we really serve different constituencies.